I'm Laura Mitchell. I'm a housewife and I'm 59 years of age and I play tennis 4 times a week. I had my first knee done 2 years ago. My second one a year and a half ago. I couldn't walk very well. Both my knees went in, so I was having quite difficulty walking and I was in extremely bad pain. So I decided I couldn't go on any longer like that. So that's why I had it done. My expectation was I would be able to play tennis after the knee operation. That's what I was told. So I wasn't going to take no for an answer. Straight after surgery, it was extremely painful. I got through it though with medication and the help of a physiotherapist. Did regular work, regular exercises every single day. I was back on the tennis court within 3 months. So I'm very, very, very happy.
Well, I'm John Ireland, and I'm a knee surgeon. I've been a general orthopaedic surgeon for a very long time, but I've been specialised in knees since my consultant appointment in Ilford, which was in 1979. The main focus of concern, let's say 10 or 15 years ago, was pain relief. You know, am I going to be reasonably pain-free? And now I think they're thinking more about the activity level that they want to achieve. On the whole, as public confidence in knee replacement has increased, expectations are higher.
My name is Jerry Els. I'm in my 91st year. Up until a year ago, I was playing tournament tennis, international tournaments in my age group. I have a number of trophies. I couldn't bring them all because there were no trucks available. This is when I was playing team tennis for Great Britain in Turkey. This plate was given to me for winning the men's over 85 singles in 2005, and also one here which was given to me to acknowledge that I was men's 85 European Player of the Year. I had my knee surgery 9 years ago. I think it was November 2002. I had pain in my left knee. It was investigated with an arthroscopy, and I was advised that I needed a knee replacement. It was that or no more tennis, so I decided I would have it done so that I could get back on the court. I thought it was optimistic, but if the intention is there and you make the effort, you can achieve a lot of things. Quite quickly, within maybe 3 or 4 months, I was back on the court, and within 6 months I was certainly playing competitively again. Since I've had my knee done, I've won quite a lot of tournaments. I recommend it to everybody.
My name is Mike Keogh. I'm 82, I'm retired, and I just laze about doing not much. I only took up tennis a few years ago and never had any proper training and so on and so forth. My wife loves walking. I hate walking. And it does give me some exercise. Though if you watch me on the court, I don't run about very much, but, you know, it's exercise. Before the operation, I was experiencing a lot of pain. When it was getting worse and worse, and it was painful, and I was sort of limping about the place. I mean, I couldn't do anything athletic. Well, I feel I had to do something about it, and I think my doctor recommended John, and I went to see him, and he said, yes, he did some other things, I think, before he actually changed the knee. Did sort of exploratory stuff and did about, I don't know the names of it, but eventually he said he had to have it, so that was it. And the thing where you have an operation, where you have a full anaesthetic, is not something that you leap into, you know what I mean? And I would have preferred not to have had it. Thank God I did, but I would have preferred not to have it. But before I had the surgery, I didn't think that I would be, I mean, I just thought it would ease the pain. I didn't think I'd be doing anything, you know. Now after surgery, I'm much more mobile than I was before. I can run, you know, a bit. I can get about, and life just seems to be normal. Anybody who is going through the same thing as I, and they ask me my opinion, I say have the operation, because it's just worthwhile. And also, if you can, have John Ireland to do it. And I don't owe him any money or anything like that. So.
Well, the perfect outcome depends on mechanical precision, getting the knee absolutely straight, and I'm obsessed with alignment, getting a really nice fit for the implants on the cut bone surfaces, really good carpentry, and of course getting the soft tissue balance correct. I chose the PFC because its instrumentation seemed to me the most straightforward, idiot-proof if you like.
My name's Harry Cohen. I'll be 72 later this year. My passion in life is tennis. I first noticed problems with my right knee in my late 50s, probably 58, 59. Any sort of sharp movement, or even walking for more than 5 minutes would start to cause pains on the inside of the knee. I lived on painkillers for probably 2 years, and it was a recommendation from my physiotherapist who recommended me to John Ireland, and he said almost immediately, well, you know, you need a new knee.
Harry Cohen first came to see me over 10 years ago, and these are some plain x-rays of his knees taken when he presented with pain, stiffness and bowing of his right knee. He had already had 2 arthroscopic operations and he was in considerable difficulty. And I'm reminded by my father that he was in pain after walking only 50 yards. So there was no question of his being able to play squash and tennis, which he had done up to that point. Nothing other than a knee replacement would have been suitable.
I was very reluctant to have surgery before I was 60. It reached a stage where, you know, even painkillers were having less and less effect. I really did not think that I would be playing tennis again. The pain immediately after the operation for the first 2 days was diabolical, and then the pain just gradually went. I started to have exercises on a knee bending machine, and it gradually improved.
And this is a film taken 2 years post-operatively, and it shows I'd begun to put tibial stems on. It shows a sided PFC implant, and I think the appearances are pretty good. And the lateral view, the tibial stem as mentioned, the patella resurfaced. I always resurface the patella. An important element, the posterior runoff of the femoral condyle is pretty well aligned with the back of the femur. I think important if you want to get a very good range of movement. Now he, again, I think wasn't expecting to return to playing tennis or squash, but that he has done.
At the back of my mind I thought, well, maybe you know, I could hit the ball and just have fun, but I didn't really deep down believe that I'd be able to play tennis at the level that I was achieving prior. But it turned out that I was. I'm certainly moving as freely as I was before. It's improved my life. It's kept my life at the level that I would have hoped it would have been, but I didn't believe it would be. If anyone asked me, you know, if they had a problem with their knee, should they have surgery, I would 100% recommend that they had it sooner than later. My game's very good. I like to think it is.